Assalamu alaikum wa rahmatullahi wa barakatuh. Good day, everyone. Another case of my EM cases series. So here's the case. 34-year-old male presented to emergency department with shortness of breath and low oxygen saturation, 82% on room air. He had past history of intravenous drug use. And so before we go to the question, so here if we digest the question or the case, we have a 30-year-old male, a young male, who is coming in with a shortness of breath, low oxygen saturation, 82%. 82% abnormal for 34-year-old male. So we think about the causes here. But they added this sentence, there is a history of intravenous drug use. That's not a good sign when you encounter a 34-year-old, shortness of breath, 82% oxygen saturation, and intravenous drug use. So you get the chest x-ray, you can see bilateral lung infiltrate, and if you can imagine, that will give you a bat wing appearance. So 34-year-old, shortness of breath, low oxygen saturation, IVDU, bat wing appearance. So the question that they may ask, what is the most likely diagnosis? It's clear it will be PCP pneumonia. Young male, shortness of breath, low oxygen saturation, IV drug use, chest x-ray showed bilateral lung infiltrate. That's PCP pneumonia. The other thing that they may ask is what blood test may help you in the diagnosis of PCP pneumonia. Of course, the one and only CD4 count should be less than 200. What's the treatment for PCP pneumonia? Always in emergency we give two things. We give antibiotic, Bactrim, or trimethoprim, sulfamethamazole. Plus we give steroid, and this is a very important drug if the oxygen saturation below 70% or AA gradient more than 35 millimeter cubic. So steroid less than 70%, AA gradient more than 35 millimeter cubic. The next question that they may ask is how to calculate AA gradient. Simple and easy. Alveolar oxygen minus arterial oxygen. So PaO2, which is the arterial, you will get it from the ABG. But alveolar oxygen, you calculate that. There is a very long equation simplified into 150 minus PCO2 multiplied by 1.25. So 150 if the patient on room air, which is 20% or 0.2 FiO2. But if it is not, so that's the minimum. If it is not, if it's in the question said patient on 30% oxygen or FiO2 0.3, so you add 75 to 150. 75 to 150. So add 75 for each 10% oxygen or 0.1 FiO2. Okay, so, and the normal AA gradient should be less than 10. And if you have old people, more than 65, you do a corrected AA gradient for age, which is 10 plus age divided by 10. The other question is, they may ask you in this situation, what are the causes of high AA gradient? Long causes, long list: pneumonia, APO, PE, ARDS, atelectasis, large VSD, ASD, pulmonary AVM, interstitial lung disease, environmental lung disease, or PCP pneumonia. So that's a quick case about PCP pneumonia. So hopefully it's helpful, and I will see you in another series. Thank you so much.